Well, in today's lecture, we will discuss the chronic cholecystitis. We will know the causes and clinical features of chronic cholecystitis. And at the last, we will talk about the sonographic findings of chronic cholecystitis. So, let's to know that what is chronic cholecystitis. Chronic cholecystitis is the chronic inflammation of the gallbladder. So chronic inflammation of the gallbladder is known as chronic cholecystitis. Now the inflammation is the protective response of living vascular tissues against any form of abnormal stimuli. If this inflammation is rapid in onset and for short duration, now this type of inflammation is termed as acute inflammation. And if this inflammation is slow in onset but for long duration, this type of inflammation is known as chronic inflammation. Now, what will the causes of chronic cholecystitis? Causes, first and most common cause of chronic cholecystitis is the calculus or gallstone. The most common cause of the chronic cholecystitis is the gallstone. Second, acute cholecystitis. Acute cholecystitis means acute inflammation of the gallbladder. Third, infection, and most common infection by the Salmonella typhi. Now, what will the clinical sign and symptoms of the chronic cholecystitis? Clinical features are clinical sign and symptoms. First, intolerance to fatty foods. Which will characterized by intestinal flatulence, and abdominal discomfort. Second, here in chronic cholecystitis, the GB will be non-tender. And now the sonographic findings of the chronic cholecystitis. Sonographic findings of chronic cholecystitis. First, the whole GB will be contracted. Here, if the gallbladder is normal, their length from neck to the fundus will be 8 to 10 centimeter. And diameter will be 4 to 5 centimeter. Now, during the chronic cholecystitis, the whole GB will be contracted. It means that the length of the GB will be reduced, and also the diameter of the GB will be reduced during chronic cholecystitis. Second, walls of GB will be thick, with altered echogenicity. Wall thickness of the normal gallbladder is 0.3 centimeter or 3 mm. Now, here in chronic cholecystitis, the walls of the gallbladder during chronic cholecystitis, the walls of the gallbladder will become thick, and also the echogenicity of the gallbladder walls will be changed. Most commonly during acute cholecystitis, the echogenicity of the gallbladder walls will be low because there will fluid accumulation during acute cholecystitis, while during chronic cholecystitis the walls of the gallbladder will become hyperechogenic because the cells of the tissues of the gallbladder wall will become shrink during the chronic inflammation. Third, if the cause is stone will be present. If the cause of the chronic cholecystitis is stone, there stone will be seen in the gallbladder, which will appear hyperechogenic with posterior acoustic shadow, like this. Fourth, sometime which sign may be seen during chronic cholecystitis, but rarely. During chronic cholecystitis, sometimes the V sign, while echo shadow sign may be seen, but this will be rarely.